Pain during intercourse is extremely common, yet most women never talk about it. If you feel burning, tearing, pressure, or deep pain during sex, this video is for you. Today, I'll explain why it happens, the different types of pain, and what you can do to fix it. There are two main types of pain during intercourse: superficial pain, pain felt at the vaginal opening, burning, stinging, or tearing sensation. This usually means dryness, hormonal imbalance, infection, tight pelvic floor muscles, skin sensitivity, vulvodynia, deep pain. Pain felt inside the pelvis, especially in certain positions. This may be linked to endometriosis, fibroids, ovarian cysts, pelvic inflammation, adenomyosis, postpartum changes. Understanding where the pain is felt helps find the cause. Let's break down the most common and treatable reasons. 1. Vaginal dryness happens due to low estrogen, breastfeeding, stress, perimenopause, or birth control pills. 2. Insufficient arousal. If the body isn't ready, natural lubrication doesn't happen, leading to burning or tearing. 3. Infections. Yeast infection, BV, or UTs can cause burning and pain. 4. Pelvic floor muscle tightness, also called vaginismus, where the muscles involuntarily tighten and cause pain. 5. Endometriosis or adenomyosis. These conditions cause deep, sharp pain during penetration. 6. Fibroids or ovarian cysts can cause pressure or stabbing pain inside. 7. Postpartum healing. Tears, stitches, dryness, and hormonal shifts after childbirth cause pain for months. Pain is always a signal, never something to ignore. Here are simple clues. Burning at the entrance gives dryness or infection. Sharp pain deep inside gives endometriosis, fibroids, or cysts. Tightness or fear response gives pelvic floor tightness, vaginismus. Pain after baby gives postpartum healing plus dryness. Pain only in certain positions gives anatomical issues or deep pelvic inflammation. Your body is giving you clues. Understanding them is the first step. Here's what actually helps. 1. Improve lubrication. Use water-based lubricants. If dryness is hormonal, ask your doctor about estrogen creams. 2. Treat infections. Get tested for yeast, BV, or UTI. These are easy to treat. 3. Warm up longer. More foreplay equals more natural lubrication and relaxation. 4. Pelvic floor therapy, the most effective treatment for pelvic floor tightness and vaginismus. 5. Anti-inflammatory diet helps reduce deep pelvic pain from endometriosis or adenomyosis. 6. Change positions. Positions with shallow penetration may reduce deep pain. 7. Medical help if needed. Ultrasound, pelvic exam, thyroid test, hormone test. Simple checks can diagnose the cause quickly. Most women find relief once they understand what's happening. Pain during intercourse is extremely common, but it is not normal, and you should never ignore it. Your body is trying to tell you something, whether it's hormonal imbalance, muscle tightness, or a pelvic condition. The good news? Almost every cause of dyspareunia is treatable with the right approach. If you want videos on pelvic floor exercises, endometriosis symptoms, or vaginal health, comment below. I'll make them next.